Number 6, Greater Detroit Area Health Council. We have 1 out of 2 Lisas. Miss Lisa Mason's with us. Miss Lisa Braddock could not attend this afternoon.
Yes, on behalf of my colleague Lisa Braddock, who is in a funeral situation right now, and all of us at the Greater Detroit Area Health Council, thank you very much for making time on your busy agenda, and thank you to Bob and to Crystal for making this possible today. I want to introduce you today to the Greater Detroit Area Health Council, affectionately known as GDAHC, and a grant that we're doing in Macomb County. It affects the county, so we think you should know about it. And then I want to spend most of my limited time with you talking about how you can help us further our grant activities. So I gave you a copy of the slides. The Greater Detroit Area Health Council is a nonprofit corporation that's been around since 1944. We're poised to celebrate our 75th year. And we are a regional health improvement collaborative. We bring people together to solve healthcare problems. And our vision, Healthy People, Healthy Economy, expresses that perfectly. In order to have a healthy economy, you need good jobs, and employers want to be located where there's a healthy workforce that's going to be productive. The two things are very intrinsically linked, and that's basically what GDAHC is all about. Historically, we focused on bringing together those who give care, get care, and pay for health care, because it's all about health. But we've recently recognized, and the health industry is moving to move more in working with all of the social determinants of health. What makes people healthy is not just where they get health care and how it's delivered, but whether or not they have access to good jobs, to transportation, to a good education. So where you live matters, and working with other sectors besides healthcare is going to make people healthier than just focusing on the healthcare delivery system. And that's what this grant is all about. It's focused in Macomb County. I didn't get the buttons right. Where's Mike? So on the next page, you can see that it's focused in 4 specific cities of Macomb County: Roseville, East Point, Centerline, and Warren. Oh, those arrows. Thank you. Okay. So it's focused on reducing chronic disease in those 4 target cities of Macomb County. It's a grant from the U.S. Centers for Disease Control through the Michigan Department of Health and Human Services. And it is a 4-year grant. We're already into the 2nd quarter of the 4th year. It will end this October. So it's not too late, but later in the process. I'm glad that we have the chance to tell you about it before it ends. Our partners in the grant, there are many. We get this done through a partnership we call Macomb Partners in Health, and it includes a number of the organizations you see listed there, and one of our key partners is the Macomb County Health Department. The grant focus is all about being healthier, and the 2 things, of course, that make you healthy are getting adequate physical activity or exercise and eating healthy. And so to summarize the whole thing, it's all about healthy behaviors like that. The activities that we've conducted over these 3.5 years that we've been in the grant, almost 3.5 years, are scattered all over the 4 cities you can see there. And I'm going to highlight just a few of them. A big part of the grant is focused on preventing diabetes. We're a great healthcare delivery system in America. If you get diabetes, we know exactly how to treat you. We've got all the bells and whistles to treat people with diabetes. But really, a better thing would be to prevent you from ever getting this really bad disease in the first place. And the CDC has a program that's tried and true and tested. 53% or 58% of the people that go through this program of pre-diabetes prevention never get diabetes. It's very effective. So we're trying to raise awareness that there is a condition called pre-diabetes. Most people think you either have it or you don't, but there's actually blood sugar levels in between not having it and having it, and that's called pre-diabetes. And if you can catch it and reverse it, you're much better off. So we want to introduce this concept to the consumer that there is such a thing as pre-diabetes. We want it to be covered by health plans and employers to offer it. We want providers to let their patients know about it and refer their patients to it. And so far in the grant, as you can see on the top of this page, we've held 28 we've trained 28 coaches how to conduct this class. We've held 32 of them. They're called Diabetes Prevention Program classes, and we've educated 340 participants. And while that's a great accomplishment, it's not enough. And this is something that you'll be able to help us with. We've worked with many of the municipalities to get complete streets ordinances and walk-bike websites where residents can find out about walking clubs and get connected to other people who are walking. We have an example of a flyer in your packet that promotes the Centerline website, and there's one like it for Roseville, so it's good for residents to be aware of that. We're working with corner stores. A lot of people get their lunches or snack food at corner stores, and when you walk in, you see potato chips and soda pop. Well, we've got 2 corner stores, Sarah's Market and Warren Woods Party Shop, that now have fresh food, an alternative to the not-so-healthy food. We've got them refrigeration units. We've helped them with promotional and pricing and placement so that people are aware and encouraged to buy these products. We also have parking lot signs, and for those who are interested, we can give you these signs for free. They're in a cement bucket. They're ready to place in a parking lot. They say, burn calories, park here, save fuel, or another one that says, burn calories, take the stairs when possible. And for those that are interested, we have those available. We used grant funds to purchase them, and we could use help getting them placed. So I've only been able to talk about a few of the accomplishments, but I want to spend the rest of our time talking about how you can help us with this grant activity. We would like to have more of these diabetes prevention programs piloted at employer sites. We had one pilot at Fiat Chrysler's Mopar's facility in Centerline, and we'd like to do more of that, offering it on-site where it's convenient for employees to attend the classes and where employers can benefit from more productive employees who aren't sick. The cost of people with diabetes is very high. We'd like you or your employer to sponsor diabetes prevention, to cover it, to work with the health plan to cover it. You could implement healthy meeting guidelines at your place of employment. You could implement healthy vending if you have vending machines in your place of employment. And you can help us identify employers in Macomb County that would be interested in doing these things. We really need some large parking lots for this parking lot sign, and we need help reaching employers. If we approach an employer as a cold call, it's a lot less effective than if someone here were to say, I want you to hear about this great program. I think your company could benefit from it. We want you to help promote the websites that I mentioned, the Owen Jacks Recreation Center, where we've improved the equipment that's available. So there's a contact sheet in your packet of information that I passed out so you can help promote some of our grant work activities. I wanted to leave a couple minutes for questions. I hope there's some time for that. Are there questions?
Thank you very much. We need a motion to receive and file. We have a motion by Leonetti, support by Lucido. Any comments or questions? Commissioner Drollet.
Thank you, Mr. Chair, and thank you for your presentation. I appreciate it. In your presentation, you list a number of accomplishments that your organization has had. Have you been able to measure outcomes of those programs? Most of the accomplishments are a description of what you've done, but have they helped? Has diabetes rates gone down when they've been implemented? Have exercise increased? Has there been any way of measuring whether these accomplishments have actually had outcomes that have been accomplishments?
Yes, excellent question, and we do try to measure outcomes for all of our activities, and you mentioned some very good measurements. The diabetes prevention program class that I mentioned is full of measurements, how much weight was lost, what is the blood pressure, medication changes. So we'll have data from the people that complete the classes. We can look at hits on the walk bike websites that were created. We're looking at healthy meeting guidelines, how many companies implement them, and then after they're implemented, how many actually follow them. So the short answer to your question is yes, we are trying to collect that data. It's more long-term. I don't have numbers with me today, but we will definitely be looking at that. That's part of how we do our work.
Okay, thank you. Do you have an indication of what you would consider the biggest success of the organization as far as outcomes? And I don't know how long the organization's been around, but has there been something you can look back at and say, we've accomplished this?
As an organization or on this, not
as
on
an
this grant, but
organization, I
as
suppose,
GDAHC.
yeah.
Yes, we have a pie chart showing the millions of dollars of impact of some of the projects we've done over the years. Yes, I could provide that.
What does millions of dollars of impact mean?
What does the impact mean? So, for example, we had a project to keep people from going to the emergency department for something that's better cared for in the primary care physician office, and we estimated the dollar impact of the emergency visits that did not occur, the more cost-effective and higher quality care that people got in their primary care physician office as a result, just as an example of one project and one way that we measured it.
Okay, thank you very much.
Yes.
Thank you. Next, we have Commissioner Kleinfeld.
Thank you, Chair. It's on page 12 of our packet. I believe it's from page 1, 2, 3, 4, 5, 6. You have a map with different icons on it, and we don't have a key. I think that the little walking guy is those signs that you've placed.
Yeah, these are different kinds of activities. The classes that I mentioned, the diabetes prevention program classes, we've had some cooking demonstrations. We've had brown bag events at Walgreens stores. So yes, good point. We should probably have the legend included on this slide so you can see it's a variety of activities.
Okay, so I went through the accomplishments because this is Warren, Roseville, Centerline, and East Point. And I found programs in Warren and in Centerline and at the Recreation Authority in Roseville. While that is for both cities, I think it's very heavily used by Roseville, and unfortunately for East Point, they're not using it as much as they should. I didn't see anything in here for East Point, so I had two questions. On your accomplishment, you have diabetes prevention program classes. Do you have any of those that are held in East Point?
I believe there have been classes in East Point. We've held them in churches, recreation centers. We're working to get some offered through our federally qualified health centers in Centerline and Warren.
So on that map, you have the little blue teardrops. What do
Yes.
they represent?
So the map that you're referring to is a map of where these diabetes prevention program classes are held, and the map at any given time only shows classes that are coming up and available to enroll in now. So the upcoming classes, I believe, are in Warren. I believe there may have even been some in Mount Clemens. I guess I'd have to get back to you. Our partners are trying to schedule those throughout the whole county. And actually, the map is tracking classes throughout southeast Michigan with other partners, not just the Greater Detroit Area Health Council.
Okay, so then you have the monthly brown bag events at 6 Walgreens stores in target cities. Are any of those in East Point?
You know what? I don't know that off the top of my head. Any Walgreens store that was in those target cities was
Well, there's
included.
like 100 of them. So if
But
there
in
are,
those-
so
in those
I'm telling
four-
you, there's more than 6 in East Point alone. So you can't
Okay.
throw a dead cat and not hit one. So all these accomplishments you've listed, if you could send over some accomplishments that have actually occurred in East Point,
Point?
since they're listed as one of the target cities, and I can't find any in here.
I would be happy to do that.
Okay, thank you,
Yes.
Chair.
Thank you, Commissioner Kleinfeld. I'm shocked that they're throwing cats around in East Point. That being said, next we have Commissioner Carabelli.
Thank you, Mr. Chair, and thank you.
Yes.
Couple of quick questions so I can get my arms around this. First of all, you said partners in
Macomb
Partners
Partners
in
in
Health. There's a Warren Park and Recreation. I looked at Roseville, East Point Rec Authority, then MSU, and the others. Are they partners in as far as working with you on this project, or is that more of a financial? How are they partnering?
Most of them are partners working actively with us on this, such as the health department, attending meetings frequently. Others, like MSU Extension, was involved in specific activities like helping to train coaches for the diabetes classes. RARE, the Recreation Authority of Roseville and East Point, served as a location for the classes. Gleaners helped with some of the food cooking demonstrations that we offered. So depending on the partner, some are more actively engaged than others. The main ones, the health department, Henry Ford Macomb, and the 2 health center, federally qualified health centers, meet with us more than monthly.
Great. And the next question I have, so it looks like you've, this is part of SEMCOG, Southeast Michigan Council of Government, the map that I'm looking at. So from St. Clair all the way down to Monroe, over to Livingston, Washtenaw, and back to the water.
Oh, the map of classes that's in your packet, yes.
Right, so are they all part of this in those in those counties they're having?
So these diabetes prevention program classes that the CDC is offering are being offered by health systems, and a number of providers have been certified by the CDC to offer them. So we collaborated with everybody to make one map of Southeast Michigan, so that it wasn't just GDAHC, here's just our classes in Macomb County, and here's somebody else's over in this county. It's everybody in Southeast Michigan that the CDC has approved to
Okay, so
provide.
then let me back up again. The Greater Detroit Area Health Council. All the money-
GDAHC serves all of southeast Michigan. But for this
portion
grant-
of Macomb County is just a portion of all the ones that are going on, and you're
Correct.
personally affiliated with this.
Correct.
So you have the 4 cities that are listed on there, and then you also asked, if there's other places that, businesses and different things, but you're looking within those cities?
Yes. For
Not
those,
outside of those
for the
cities.
employers that we're trying to work with, we'd like them to at least be in Macomb County, ideally in one of
Well,
those.
no, we all want it to be in Macomb County.
Yeah,
Harrison Township, Commissioner Leonetti, he has like 3 places he wants you to go to, but he's not in one of these 4 cities.
yeah,
So-
likely though the employer has at least some employees from those 4 cities. So if the business is located in Macomb County for these things that I've listed here, we would be very happy to work with that business on these activities.
Okay. All right, thank you. Thank you, Mr. Chair.
Thank you. Commissioner Leonetti.
Thank you, Mr. Chair, and thank you, Mr. Carabelli. Commissioner Carabelli kind of almost helped me with my question. I understand the grant, that your source of funding for this comes from a grant. I guess the grant comes from the state of Michigan, is that correct?
It comes from the CDC through the state of Michigan.
Okay, and if you know, how was it determined that these 4 cities would be
Yes.
chosen in Macomb County?
We chose those 4 cities when we applied because those are the 4 most needy cities within Macomb County.
Okay, okay.
I
And
can
wh-
give you some statistics. on
Okay, no, and I kind of thought that they're populated or needy. I get that. No offense to the commissioners from there. The next question is, the grant runs out this October, correct? What are the prospects of this grant continuing, and what are the prospects that the grant would expand into other cities in Macomb County?
So the grant itself and the funding aren't expected to be offered again. However, a big part of this year's grant activities is focused on how do we sustain this work when the grant ends.
Okay.
So we hope that activities, and we are confident that the diabetes prevention program classes will continue.
Okay, okay, thank you. Thank you, Mr. Chair.
Thank you very much. Any other comments or questions? Seeing and hearing none, we have a motion to receive and file.
Thank you.
It just blew up. I. And Lisa, thank you very, very
Thank
much
you
for
very
coming.
much.
Very informative. Look forward to your successes in Macomb County.
Thank you, and thank you again.
Thank you.